All right, thank you, Mike. Well, March is Colon Cancer Awareness Month, and joining us right now, we have Dr. Jeffrey Goldstein, a gastroenterologist from Rochester Regional Health System. Thank you so much for joining us.
Thank you for inviting me.
So this is so interesting. What I found interesting reading your material, and we can talk about colon cancer in a second, but just the symptoms that you can keep an eye out for. There's a long list, and some are very specific.
Yes. So patients, first off, may not have any symptoms and have a colon cancer. Bleeding, rectal bleeding, change in bowel habits, abdominal pain, or weight loss may be symptoms of a possible colon cancer.
Good, that could easily be symptoms of something else, though, right? So many symptoms of other things.
Exactly, and that's why I think if anybody has any change in bowel function or anything that may make them think that something is awry, that they should go ahead and seek medical attention.
And a blood test can test for this possibly, because you would almost appear, what, anemic or a low blood, red blood cell count?
In some cases, you can develop anemia. A patient may develop anemia. Sometimes we see patients that have colon cancer that may not even have anemia, but there are certain tests that can be a sign of it.
Mm-hmm.
So do you start with your primary care physician?
Yes. I think if someone has symptoms or they think something is wrong, they should seek medical attention, speak to their primary care physician first, and then they can get referred into us.
How preventable is this disease?
It's a very preventable disease. I think when you look at the population and you look at patients in the screening sense, that anybody that generally is 50 years and above should have a colonoscopy for screening purposes in the general screening sense, because the nature of colon cancer is that they all develop from polyps, which are little growths in the colon. If you remove the polyp, you interrupt the sequence and you prevent colon cancer from developing. So I think the key thing is finding that polyp if it's there, and it can be very asymptomatic and not have any symptoms, any blood lab tests, abnormalities, and someone can have it. So I think that's the active nature, is to be proactive and go ahead and do that.
And a lot easier than it used to be in the past.
Absolutely, that's a great point. I think that colonoscopy has become an easier procedure. Preparation for it, understanding the risks and benefits, even what we do with our scopes, more flexible scopes, better anesthetics, and I think overall it's a much easier procedure. Most patients actually tell me after the procedure the toughest thing was the prep. If I knew it was this straightforward, I would have done it earlier.
Interesting.
How about the procedure to remove a polyp? Is that a major operation?
It's a very good question. It all depends on the size of the polyp. Most polyps you remove, we can either use a little lasso like a snare, either use cautery, which is some heat, electric cautery, or we can just remove it, just kind of truncating it with the snare itself, or we can use a little snipper, little biopsy forceps that can remove the polyp. There's always risk removing polyps, but the key thing is to get rid of them. If they're too large and we don't think we can safely, adequately remove them colonoscopically through the scope, then they'll need surgery. But the key thing is finding them, identifying them, and then we can deal with them.
And even if it becomes cancerous, that's still operable. You can still get rid of the tumors there. The danger is if it gets into the lymphs, and then it can spread, right?
Exactly, exactly. So I think finding things early enough, even if there is, God forbid, a cancer, we can still take care of it. It's still a treatable disease. The key thing is finding things as early as we can so that we can deal with them better.
Speaking of that, guidelines continue to change with different procedures. What is the guideline these days with when you should maybe start having
colonoscopies? I think colonoscopies for the screening population 50 years and above. Anybody with symptoms should really seek medical attention. So I don't care if someone is 18 or 90. If they have symptoms, they're worried about something, they should seek medical attention. But from a screening sense, 50 years and above, if they have a family history, generally we go 10 years before the index case. So if Dad had colon cancer 55, they would start at 45.
All right. Dr. Goldstein, thank you so much for your time as always.
Oh, thank you so much for inviting me.
All right. Local headlines are next.